Hi everyone, kia ora. So Wendy Maddocks from the Faculty of Health, obviously. I don't have my PPH because I'm just working on a new one as of yesterday and I haven't finished perfecting it. So gratefulness to Atawhai for helping me with that. So I'm talking today, last year I was very lucky to go on sabbatical and spent some time in the UK at the Christie Hospital and looked at their services there. Can you hear me without the microphone?
Oh, well, just get you to put that
That,
down,
yeah.
go through the
Oh, there we go. That's better. So, firstly, the Christie Hospital is Europe's largest cancer treatment hospital. It's based in Manchester, UK, and the Complementary Health and Wellbeing Service there was the very first one in the UK, possibly the world, established about 25 years ago. They made many changes in response to the COVID situation, and they hadn't had a service evaluation for a long time. And I'm very professionally connected with the nurse consultant who's in charge of the unit. And once travel was allowed, we started to talk about whether I come over and do a service evaluation. So that's with Dr. Jackie Stringer. Lots of preparation beforehand, as all of those who've involved in anything with another organisation, let alone another country, is involved, and had to meet sort of legal requirements of being a visiting scholar. So the planning began October 22 and the visit took place in 2023. So very much it's a nurse-led service and involves around 20 paid staff working in the service. Not all of them are nurses, some of them are integrative therapists, plus a research team and a research assistant. So the purpose was to evaluate the service as it's delivered and to sort of really learn how it runs and whether something could actually be replicated here in New Zealand. Now, going to work at Europe's largest cancer hospital, you think amazing buildings. The service was actually in Portakabin out the back that was about to be condemned and having some work and things done on it. But the rest of the hospital was amazing and huge, has a massive campus. And what I was really looking at was the clinical services, but there's also research outputs and a teaching unit as part of it. I interviewed staff, 17 of the 20 staff who were there. 3 were either on holiday or long-term sick leave. And I interviewed patients both in the hospital, so whilst they were in hospital receiving treatment, or interviewed them as outpatients, or interviewed them after they had finished treatment, both cancer treatment and the service treatment, and then interviewed some other clinical staff. One of the things the service did that was really innovative with COVID, recognising the immense stress on staff, was they set up a service specifically for staff to have interventions to help them manage their stress and anxiety. I couldn't get any of those staff service users, they were called, to be interviewed, but the graph on the end there was a review that the nurse manager had done to find the value that the staff had of receiving an integrative therapy. And I'll explain what they are in a moment. So they were interviewed and transcribed, so I tried the Transcriptor app for the first time and pre-tested it because there was a lot of regional dialects in Manchester and Northern England, so we had quite a bit of fun around what they said and what came out. Popped everything into NVivo as a way to just look. This wasn't research, I wasn't looking for themes, but I was just trying to find some commonalities there. So there's 4 parts to the integrative therapy service, and I'm sort of speaking hopefully that everyone sort of has a bit of an understanding of integrative therapies, complementary therapies. Firstly, there are integrative therapists, and they all have a bachelor's degree in some discipline, so it might be massage, aromatherapy, reflexology, herbal medicine, and they have at least 2 other skills to add to their belt. The integrative therapists, they also may be trained in hypnotherapy, and they are referred to the service by the clinical staff on the ward. So each day referrals will come through to say that we need someone to go and see this patient. A couple of abbreviations in there, so PRN, so as required, sorry, I'm going to bit of nursing language, and I know there's a few nurses in the room. Head and neck, HAN, so that's head and neck radiotherapy. So people having radiation to this part of their body because they've got a cancer, usually oral cancer, and the keeping people engaged in the radiotherapy is critical, because if you miss even one dose of radiation, that affects your outcome, and also really costly to the service. The other part of the team is the health advisory team. So these are not health professionals, but they are trained in smoking and drug and alcohol cessation, and they are basically with radiotherapy, as soon as a patient is diagnosed with cancer and needing to come in for treatment, a box is ticked that they're a smoker, a drinker or drug user, or they have anxiety, and that health advisory team sits in and sees the person after the consultant. They're the next person that they see to talk about how they can stop smoking, alcohol use. So I got to see a patient all the way through that journey. The other main clinic was the nurse consultant clinic, so she works completely independently within the hospital. Patients are referred to her for really complex side effects of their cancer treatment. So this is things like neuropathic pain, host versus graft disease, where basically all your mucous membranes just fall out of you, whole range of kinds of things. And she is using predominantly aromatic and herbal medicines to manage these side effects and symptoms. And then the final thing is the acupuncture clinic, and patients have a prescribed course of acupuncture to manage their neuropathic pain. And also for hot flushes, which is people who have had hormone-dependent cancer treatment. So a real range of services. Highlighting there just the things I really wanted to show with you is the strengths of the service, absolutely groundbreaking, innovative, it's well run, it's well resourced. Pre-COVID, it was predominantly volunteer basis, but they secured funding to keep the service running, and so all of the staff are paid, and paid equivalent rates to other clinical staff. At least 150 publications have come out of the service, and multiple presentations. So Prince Charles, he was then, but obviously King Charles, quite heavily involved, and they've won a number of awards, and they often go off to London for dinners and win awards. And very much the focus is on evidence-based practice. Everything they do is based on evidence. But some of the things I found through the evaluation was within the medical community, not so widely visible, and not presenting at medical conferences, not publishing in medical journals. So the doctors knew the service was there in the hospital, but didn't really quite know how to access it or what the benefits were for their patients. And the last thing, and this is something they're working on, is that the follow-up and the evidence was not very well done. Getting data from the service was quite hard, and then obviously the clinicians didn't want to ask a patient how they found the service after they'd just given them a lovely treatment and they'd fallen asleep and was free of pain. A couple of little graphs, because there's people in the room that might like graphs. So data from, this is all obviously through COVID, the telephone consultations went up exponentially because they couldn't see a lot of patients face to face. And the predominant reason was for stress management. So this is not trying to replace the treatment of their cancer, it's helping people cope with their cancer or manage the side effects of their cancer treatment. Stretchy man, I don't know if anyone's seen one of these, so everyone would be posted a stretchy man, a star, so a squeezy star for stress management. Just some thank you cards there. That's a sign outside a ward explaining what the services are. These are the essential oil aroma sticks. So these are pre-blended by an aromatherapist, and they will be sent out to people and told how to use them. So again, managing anxiety, stress. A lot of people having radiation treatment are claustrophobic. And if you've got to sedate someone to have radiation treatment, that's a cost. They're staying in hospital. If they can use an inhaler and some hypnotherapy techniques to get through their treatment, that's a bonus for the patient because they can go home. Little acupressure ear seeds, and that's just a couple of little clinical pictures for my nursing colleagues. They had a special clinical room set up where the oils would be created and dispensed. And I just really wanted to finish, I guess, with this quote. Cancer strips you of so many things, but this pessary, so this patient was having vaginal pessaries, aromatherapy pessaries, is a way of keeping control, because intimacy is really important to our relationship. Hormone therapy, it's like a light is switched off overnight. I'm grateful, really, really grateful for all the treatment, but holistically, it's not always looking at the bigger picture. So she's talking about the cancer treatment that's cured her cancer, but the side effects she was left with. And that's just some of the team there. So ngā mihi nui, thank you very much.